amazing mother.
Alright guys, this is our 10,000 subscriber special, and we asked you if you have any personal questions for us, and here we are, happy to answer everything. First of all, we want to say we are really grateful and happy about your support and all the positive and also negative feedback that we received. This is what keeps us going, and also this is what motivates us to improve our videos. So every time you have something that you don't think is proper, just comment in the section down below. Ask us anything, we are happy to help. Okay, so first question was from our colleague Max Herbst from Physio Crew in Germany, and he asks, will you guys be at the Mulligan course in Stuttgart next year?
Depends on what time, I guess, when, and if you want us to be there, maybe a formal invite with 2 tickets, and then we're happy to be there.
You realize it's my hometown, Max, so I'd be very happy to be there.
Let's see. Anna Gunner on Instagram asked, if you could talk about only one subject for the rest of your life, what would it be?
Yeah, you know my answer. I'd say I love physio, but my number one ticket would be women, I guess. What would be yours?
One topic. I can't change the topic for the rest of my life. Food. I guess food.
Okay.
Yeah.
And maybe soccer. Soccer is also a good one. So I'm undecided, to be honest.
Yeah, but you know, soccer. Everybody loves food, so you can still have good conversations with people.
Yeah, that's a hard one, I guess. That's really a hard one.
But good question.
Okay, then the next question is from Gustavo Garcia, and he is asking, if you guys were a bone, what would you be and why?
I would be humorous.
And why?
Because I have great humor.
I think Andreas would be a Talcanius.
And grasp the Talcanius?
A Talcanius, yeah. Yeah. Or a piriformis bone.
Yeah. No, I'd be femur, of course, because it's the longest and strongest bone in the human body.
Yeah, that's a cool one. Again, at max.herbst on Instagram. How much do you squat/deadlift?
So 3 sets, 3 repetitions, 130 kilos with the squat, and deadlift was 3 times 4 with 140, I guess. Yeah.
115 kilos, 5 times 3.
Squat that.
And deadlift. Right now in my scheme, I don't do regular deadlift. I only do Romanians. So, yeah. We have a question on Instagram from Sarah aus der Eifel, at Sarah aus der Eifel. Are you single?
Yeah, at the moment, yeah.
I'm not. I'm in a relationship. Sorry.
I actually forgot to say for Nadia, huh? Any applications at kai@physiotutors.com with a picture.
Okay, we have a question from Shaktin Aful on YouTube. I'm currently studying sports therapy, and one of the main units is anatomy. Any tips on how to study anatomy?
I think what helped me the most was not to learn every function of every muscle by heart, but rather to focus on where's the origin and where's the attachment of a muscle. And then you can basically explain to yourself and deduct from that knowledge what a muscle is doing. If you think about a punctum fixum and the other point that moves, and you look at it from every plane, then you can basically see what's happening in the muscle. So that would be my advice. And also, I gotta say, no single minute that I spent studying anatomy was a wasted minute. So I think you can't have enough anatomy knowledge ever.
At Yabu31 on Instagram, German guy. So, wo haben wir studiert? Selbst studiert er in Herlen und schaut immer mal wieder bei uns rein. So, he's asking where did we study, and he's studying in Herlen, another city here in the Netherlands, and that he checks in with us once in a while. So yeah, we've studied at the European School of Physiotherapy here in Amsterdam. It's an international program of the Hogeschool van Amsterdam. Yeah.
Yeah, and currently we're doing our masters at the SOMT in Amersfoort.
Anu_Sha4 on Instagram asks, why did you want to pursue physiotherapy?
Now, I did ICT, or like I did IT, and economics was a combination of the two before. Didn't like too much. It was okay, good payment, but my passion was always, or my interest was always sports and everything about medicine and health. So yeah, then you kind of left with physio because that's the perfect combination of the both. And I never regretted studying again.
Because I enjoy doing sports, and my dad's a doctor, so I kind of was always in contact with the healthcare field, and I looked into physio a bit more, and it appealed to me, and I still enjoy it till today.
Yeah, I think I gotta add, it was not only my own interest and passion about those topics, it's also that you have a lot of patient contact or contact with other people, which I enjoy a lot, and of course if you can make someone's life a little bit better, it's pretty awesome to me. And this is what I didn't have back in the office, because the business is central and not the person or the human.
I think you can have an impact on someone's life, and it's pretty cool. All right, we have at Paddy_Soleil on Instagram asking, do PTs in the Netherlands have to take national board exams to be certified? No, you don't have to take any board exams. You do your Bachelor of Science, which is a 4-year study usually. And after that, you have your diploma, and then you can register with the Dutch Association of Physiotherapists. And then you're basically registered as a physio, and you can start working.
Yeah, you have to collect a couple of points by working as a physio, and you have to prove that to the Dutch Royal Society of Physiotherapy. So you have to collect a couple of study points every year, and also prove that you're having contact with patients sufficiently, so because otherwise you would lose your accreditation. All right, then we got a couple of questions from YouTube, and it's basically about content. So the Humming Boy asks, can you guys make a series of videos covering the use of Mulligan techniques on various musculoskeletal conditions?
I mean, we've been to a Mulligan student seminar, but we're not Mulligan certified practitioners, so I guess we'll have to decline, and maybe in the future could be possible, but right now, sorry, no. NCH on YouTube asks, could you produce a video about selective tissues tension tests? Thank you so much.
I have no idea what that is, to be honest.
Me neither.
I gotta look it up, but yeah, I think from our answer you can already tell that it's not super likely, but I mean, we're always looking up everything that you ask us and that we don't know, and yeah, but at the moment, no idea, sorry. Nadia Sava has 2 questions actually, or 1 demand. She is saying, please upload muscle strengthening, and the other one is and pressure points on head region with full explanation, please.
Yeah, I guess muscle strengthening, we will certainly do that in the future. Pressure point and head region, I guess you're talking about myofascial trigger points. Could be a topic that we cover in the future. Charlie Hewitt on YouTube asks, as a year 2 uni student, we are studying mobilizations of the cervical, thoracic and lumbar spines, such as SFMA assessment, cervical flexion, extension, rotation, and accessory mobilizations, so PAs, transverse and unilateral. If some of this content was covered in your videos, it would be of great help.
Yeah, that's definitely gonna be video content soon. I mean, we are studying our masters at for manual therapy, so that's definitely a point, but yeah, we're just starting, so our knowledge is not too profound, and also our handling isn't, so as soon as we are better at that, you can definitely expect videos about manual therapy for sure. Then Fat Al Hassan is asking, hi Physiotutors, your videos are awesome and informative. Thank you very much.
Thanks.
What can be done for a patient with T7TH, disc bulge, left side that is causing pain, radiating to the left lateral thoracic area, up to anterior left epigastric area? I mean, what can be done in terms of manual therapy techniques? Thanks. So I think first of all, that's a pretty rare case, right? With we know 2% of thoracic
disc herniations.
It's pretty rare. So that's for one. I think that's it's difficult to find anything in the literature. And second of all, it's what we just answered here with manual therapy. We just started, so I think we are not that proficient to answer you on that question right now.
Okay, Swan Mario on Instagram asks, can you make videos about treatment of cases, not just diagnosis and test? Smiley emoticon, thanks.
Now, I'd say at the moment our backbone is our clinical tests, and it's all about assessment, but we definitely want to go into the direction of to have more clinical reasoning, and that will also involve cases.
Fayaz Khan on YouTube, kindly show treatment of various neuromuscular myoskeletal conditions. You people do great work, keep up the good work, love from India. So yeah, first of all, we realized that we have big support of the Indian community.
Yeah.
So thumbs up for that.
Yeah, thanks for that. Thanks for the compliment as well.
Yeah. So again, maybe to connect with the question from before, yes, in the future you can expect also more of the treatment branch and not just the diagnosis, and that might also include neuromuscular and musculoskeletal conditions.
Yeah. And we also started with, for example, explaining different pathologies or conditions, like in our shoulder impingement syndrome or subacromial pain.
Thoracic
explained
outlet.
Video or thoracic outlet, right? You can see that we are trying to also cover common pathologies and basically tell you what it is and what can be done about it.
Pilorisiri_Chandana on Instagram. I like your videos. Can you explain about the NDT technique?
We get a lot of questions about PNF as well, and we realized that a lot of people use that, but yeah, again, we are not really experts on neurology, so someone else might cover those topics, but yeah, our focus is more on the orthopedic part of physio. Okay, so I think those were all the questions that we got from you guys. Again, keep on watching our videos. I hope you enjoy them a lot and you benefit from them. We are convinced of that, and we are trying to improve what we put out there. And of course, our motivation comes from you guys. If we didn't have any followers, we would have stopped by now for sure.
Yeah, definitely.
So, and if you have any questions about us, about the content, don't hesitate to drop us a comment. We are gonna answer usually within hours, the latest. So just keep on contacting us.
Yeah, and thanks for 10,000. Seriously, we can't emphasize that a lot. It's a big milestone for us to reach that number. And yeah, thanks again. Huge thumbs up to you guys. I hope you enjoyed this video as well. This was Andreas.
And this was Kai.
For Physiotutors, and we'll see you at 100,000.
Okay. Take care.
See ya.
Bye.